morning, everyone.
Good morning.
We're going to get started. We have Dr. Parsons and her students, Savanna and Kai, that are going to present for us this morning as part of our wellness. So they are going to give their presentation on diabetes this morning.
Can y'all hear me okay?
Oh, yeah.
Awesome. Good morning, everybody. So I'm Savanna, and this is my partner, Kai. So today, this is just an overview of what we're going to be going over. It is the background of what diabetes is, as well as how to monitor your diabetes with the continuous glucose monitors and the new continuous glucose monitors that we're going to be talking about. And then we'll finally go into just an overview of new and future diabetes medications.
A little closer to the mic.
Okay, should I hold it? So what diabetes is, it is where your body has a hard time managing what your sugars are and or how high or how low that they get. And that is from insulin. So insulin is a hormone that brings the sugar from in your blood into your cells for energy. So there are two types of diabetes. The first one is type 1, and this is where your body is attacking the cells that make insulin. And then the second is type 2 diabetes, and this is where your body becomes resistant to insulin and no longer responds to the insulin. And this can come from lifestyle and genetics, so such as weight or age. It is important to manage your diabetes because if you have a high blood sugar over a long period of time, things can happen such as nerve damage, kidney or eye disease, heart disease and stroke, and even an increased risk of dementia. Next, we'll go into what a continuous glucose monitor is. So we call it a CGM, and it's just a tiny sensor that's typically under your skin on your upper arm that is going to measure your sugars continuously. And it will send the data to your smartphone or to a sensor reader. There are two types, the Dexcom G7 as well as the Freestyle Libre 3. And what they do is they send that data to your phone or reader, and that is used to help support or track your morning highs or overnight lows. And then you can use that data from your sensor or phone in order to adjust your insulin, your food intake, or your exercise. Now, as I said, there's new over-the-counter CGMs. So these work exactly the same as what I just said that the Dexcom G7 and the Freestyle Libre do, but this one is not required for a prescription, so you don't have to ask your doctor for it. You can just buy it over the counter at a CVS or HEB or even Amazon. And this is used to help empower you to make smarter lifestyle and meal choices. There are a total of 3 different ones coming out or already out. And those include the Dexcom Stilo, the Freestyle Libre, or the Freestyle Rio, and the Freestyle Lingo. First is the Dexcom Stilo, and this is for adults who have type 2 diabetes but are not on insulin and just want to help track their patterns and help adjust their lifestyle changes. How it works is that it reads your glucose, or what we call sugar, every 15 minutes for that sensor. And then using the smartphone app, it will graph any of your past hours and days of what your sugars are looking like, and it can show trend arrows of what your sugar might be heading towards, if it's going to go low or high. So the sensor lasts for 15 days. And then you can buy one box that comes with 2 sensors, so it's a total of 30 days, and it's going to be $99 for that sensors. And just some important things to know, that this one is not used to dose insulin or treat any low sugars. And if you do feel like you're having a low, or what the sensor is reading doesn't feel correct, just make sure that you do a finger stick to make sure. Next, I'll hand it over to Kai.
Thank you. Alrighty, so next we're going to discuss the Freestyle Lingo. So this one is going to be a bit different than the Stilo in that it's for adults without diabetes who are just wanting to improve their overall health and wellness. This one is going to be a good option for those who are pre-diabetic. And how this works is, instead of reading the glucose every 15 minutes like the Stilo, This one reads your sugars every 1 minute, so it's more frequent. This one is going to show the readings through the app, so similar to the phone. And this one is going to be really good because it provides just personalized insights on like your diet and exercise, and it also provides customized coaching. Alrighty, and for this one, each sensor lasts 14 days and then you replace it. It's a bit cheaper than the Stilo. This one is going to be $89 for 2 sensors, and it's going to be a 28-day supply. Similarly, this is not used to dose insulin or to treat sugars. And again, if your symptoms don't match, just go on ahead and confirm it with the finger stick. Alrighty, and for the next sensor, this is going to be called the Freestyle Rio. This is also going to be for adults with diabetes who are not on insulin, and it's used to track patterns and of course to help adjust the lifestyle. This one also reads every 1 minute, and it's going to show the readings through the app. This is also going to show the current readings along with your previous readings. So it's going to look like a graph, and you're going to be able to see like the trends. So this one is just going to be a bit easier to read on the phone. This sensor lasts 15 days as well, and then you'll replace. The price is not officially announced yet, but it's likely going to be in the same price range of the other 2 sensors, so usually around $100. Again, this is not used to dose insulin or treat sugars, and if the symptoms don't match, go on ahead and confirm it with the finger stick. Alrighty, so we're just going to be discussing like some keys and tips of how to keep your sensor in place so you can just get the longevity of it. So there's 2 types of patches. There's the under patch. This is going to be placed under the sensor, as the name implies. This is going to be good for just to protect the skin from irritation. This is going to be the best option if you have an allergy or you get rashes from adhesive. The next patch is going to be called the over patch, and again, like the name is implied, it's going to be placed over that sensor as you see in the picture here. That's going to be placed on top of the sensor to keep it in place when you're doing like exercising, sweat, or showers. So this one is going to be more geared to the active participants. Alrighty, and just some pros and cons of the over-the-counter CGMs. The advantages is that you don't need a prescription, so you don't have to go through the hassle of seeing your doctor, and you're able to check your blood continuously. And you can also see in real time how your hard work, like your food and exercise, is affecting your numbers. You can also share the data with the provider when you do go to them, just so that you don't have to keep like a paper copy. They can just see it electronically. The disadvantages is that it's not approved for insulin dosing or treating low sugar. Sometimes it's not covered by the insurance, and it doesn't replace your regular provider visits. And here we just have like a comparison chart here so that you can just see the product, so which CGM and then which is best for you. Alrighty, so with the CGM's track, again, it's just going to be your blood sugar. The trend arrows are going to be beneficial just so that you can see exactly when you're running high or you're running low. The goal and range is we're going to want to be between 70 and 180, and that's something that your Dexcom on the app will show you. So it's going to be really clear. I don't know if y'all can see it, it's kind of small, but you can see the numbers there on the app. This is going to be important because it shows, again, how your food and your activity are affecting you, and it's going to be able to help you just spot the pattern. So if you're eating something in particular and you notice your blood glucose rise, that's something that can be helpful there. You can also catch the highs and lows early. Alrighty, so now this is the fun part, well, at least for us. So we're going to be talking about the different medications for diabetes. There's 2 types. There's going to be oral medications and then like the injections or things that are not oral. So I'll take over the oral here and we'll start. Alrighty, so the first class are going to be called the SGLT2 inhibitors. These I call the Flozin drugs. So you can see the names there, canagliflozin, dapagliflozin, and empagliflozin. all of those are very hard, not fun to say. So the flows and drugs here. How these work is they help your kidneys get rid of excess sugar through your urine. So the sugar is going to leave your body that way instead of staying in your blood. These drug classes, they also help with kidney benefits. And something that's important to know is these are once daily drugs, so you don't have to worry about taking them in the morning, at night. So it's a bit easier, for you to just take it and forget it. There are some common side effects with these drug classes. Most commonly are going to be like UTIs or yeast infections. That's also common for both men and women, but of course more common with women, unfortunately. And you also may notice some increased urinary frequency because of how the drug works, eliminating the sugar through your urine. Something also good to note too is that it does reduce your A1C pretty well, about 0.5 to 1%. Alrighty, and the next drug class here we have is the GLP-1 receptor agonist. I'm sure we've all heard the buzz around Ozempic. So this is the oral form of that. It's oral Ozempic, also known as Rybelsus. How this works is it helps your body release insulin when you eat, and it also slows down the amount of food leaving your stomach, and it helps you feel full sooner. This can help lower your blood sugar, and also it may even help with weight loss. Something that's important to know with this one is that it's good to take on an empty stomach with a small sip of water, just because this can cause like unwarranted GI effects such as nausea, vomiting, and things of that. This also will help you feel full quickly. So you're going to want to wait at least 30 minutes before eating, drinking, or taking any other medication. This also reduces your A1C a bit more than the previous class. This one goes to 0.5 to 1.5% reduction. Alrighty, the next class we have here is called Baguanide. This is going to be like your metformin or your glucophage or Glumetza. This works by stopping the liver from making too much sugar. So this is going to slow down how much sugar your body takes in from the food when you eat. And this just helps your body use the insulin better. Something that's good to know here is this is going to be twice daily dosing. So you'll take it in the morning and then again at night. This one also has side effects of nausea, diarrhea, or gas, which can be eliminated or at least toned down when you take it with food. Something else that's good to know here is if you're using this medication from 5 to 10 years, it may lead to a vitamin B12 deficiency, and that can cause anemia or even nerve problems. This medication reduces your A1C pretty well by 1 to 2%. Okay, and next we have the DPP-4 inhibitors, also known as the gliptin drugs. So the linagliptin, alogliptin, so on and so forth. How this medication works is it helps your body release more insulin when your sugars are high, and it'll stop your liver from putting out too much sugar. This one does not affect like how full you feel or how fast your stomach empties, so you may not notice like any appetite changes with this. This one is also taken once daily, and this is very well tolerated. The side effects are very minimal, but some patients do experience like a mild headache. Some types of the DPP-4 inhibitors, they may rise your risk of heart problems. So they're not recommended if you have heart failure. So saxagliptin and alogliptin will not be recommended for that. And these decrease your A1C by 0.5 to 1%. Alrighty, and next we have TZDs. These are going to be pioglitazone, also known as Actos. How this medication works is it just helps your body respond better to its own insulin that it's releasing, and it tells your liver to make less sugar. This is going to be taken once a day, and a common side effect of this medication will be weight gain, and this one is also not recommended for those who have heart failure because it can exacerbate it and make it worse. Some downside to this medication is that it does take a full 8 to 12 weeks to see the full benefits, so it takes a bit longer than the previous medications. And this does reduce A1C by quite a lot, 1 to 1.5%. But a great part to this medication is that it helps mitigate the risk of MASH, which we'll get into. And it is not mashed potatoes, unfortunately. What MASH is it stands for metabolic associated fatty liver with inflammation. If anyone's heard of NAFLD, it's different because it's worse. So it's not the non-alcohol fatty liver disease. What MASH is it happens with those with type 2 diabetes. It basically means that there's too much fat buildup in the liver and it causes irritation and damage. So it's a more serious form of fatty liver disease. And over time, this can lead to the scarring of the liver, which is called cirrhosis, or even failure if it's not managed. Alrighty, in the last oral medication here, these are called sulfonylureas. So these are going to be glipizide, glucotrol, and Amaryl. So this works by helping your pancreas or make more insulin, even when your sugar isn't very high. This is a once daily dose. Some common side effects are going to be weight gain and low blood sugars, but otherwise it's pretty well tolerated. The caveat to these medications is after about 5 to 10 years of having diabetes, the medications slowly lose their effectiveness. So most oftentimes when you start on this medication, you'll be switched to another drug class. This medication class does have a high risk for low blood sugars, but it does reduce your A1C by quite a bit, 1 to 2%. And I'll go on ahead and, spoiler, hand it back over to Savanna.
Hello, I'll be talking about the injectable medications that are used for diabetes. We have the GLP-1 receptor agonist, dual GIP, GLP-1 receptor agonist, and then insulins. So for the GLP-1 receptor agonist, Kai talked about it a little bit with the Rybelsus, except that the injectables are a little bit more effective than the oral medication. And there are two ways that this medication can work, and so it helps slow down how quickly the food is leaving your stomach and help your pancreas release more insulin after your meals. Examples of this include the Ozempic, Trulicity, and Victoza, and that is used for people who have type 2 diabetes. And then it also is approved by the FDA for chronic weight management, and an example of that is Wegovy. Some important things to know is that some of these medications are dosed once weekly or once daily. So the Victoza is once daily, everything else is once weekly. Some side effects that Kai talked about is nausea and feeling full quickly. So to help with that, just drinking small glasses of water and smaller, less greasy meals can help. And if you've had pancreatitis or thyroid cancer in the past, you cannot use these medications. Next is the dual GIP, GLP-1 receptor agonist. And so this one is just like what I just talked about, but it has a second hormone to also help that gives better efficacy for helping with the sugar, lowering your sugar and weight loss benefits. Examples of this that are FDA approved for type 2 diabetes is Mounjaro, and with chronic weight management, it is called Zepbound. And again, just if you're feeling nausea or feeling full quickly, using drinking water as well as smaller portions of food can help with that. And of course, since it is a GLP-1 in it, you cannot use it if you had pancreatitis or thyroid cancer. And just an important note that we wanted to talk about on an FDA safety alert is about the compounded GLP-1s. So recently, these got really popular and there was a really big shortage, and so people weren't able to get their medications. This allowed that some pharmacies and clinics were allowed to make their own GLP-1s called compounding it. And these are not approved by the FDA, and because of this, sometimes there were dosing issues or not proper education on how to use it, and patients were having up to 20 times the dose that they should be, and that was causing people to have to go to the hospital. So what we recommend is that you only use the FDA-approved GLP-1s that you get from the pharmacy like the Ozempic, Wegovy, or Mounjaro. Next is the different insulin types. So insulin is not a drug. It is something that you're replacing your body that is not having enough. And as I said, how it works is it moves the sugar from your blood into your cells for more energy. And there are two types of insulin that we have right now. There's bolus insulin that works really quickly, and you're going to be giving this right before you take any of your food. Examples of this include Humalog or Novolog. And then there's basal insulin, and this one is longer acting, so you give it to yourself once a day, and it will work all day and night to help keep your sugars stable. Examples of this include Lantus, Toujeo, and Tresiba. And some tips on giving yourself injections, just make sure that you're taking it at the same time each dose. So if you're on a GLP-1, give it at the same time every week, if it's a weekly one, or if it is your long-acting insulins, giving it at the same time every day. And then for the bolus, which is the rapid-acting insulin, you only take it before you have meals. So if you're skipping a meal because you're not feeling hungry or you don't want it, don't give yourself the insulin because it's only working for your meal that you're eating. We had a patient recently who he accidentally gave himself the bolus insulin right before his meal, but he decided not to eat, and his blood sugars dropped to 38, which is very, very, very low and scary. So we want to make sure that you do not give yourself any bolus insulin. Next is store your unopened pens in the fridge. Once you open them and use them, you can keep them where you best remember to take them each dose. Thirdly, we want you to rotate your site where you inject it just to keep your skin healthy, because if you continuously inject yourself in the same spot, it can lead to some of your skin not having bumps and things like that. Lastly, we just want you to watch for low signs of blood sugars, because especially with insulins, if you go low, you can pass out and not even know, and it's really important that if you feel like you're going low, to treat as necessary and make sure. Now we're going to be talking about new approaches to diabetes management that is coming out and on the horizon. The first one is the islet cell therapy, and this is for patients who have type 1 diabetes. And so scientists are working to replace the cells that are in your pancreas that make the insulin, called the islet cells, and so that your body can start making its own again. The therapy is called VX-880, and it's using lab-grown insulin-producing cells. And in some of the studies, people were able to stop taking insulin for up to 2 years, which is amazing. So this can help you not having to take those daily insulin injections every day. Next is once weekly insulin. So this is going to be like the basal insulin that I talked about that you give yourself every single day, but this one is once a week. So you only give it once a week, and it has a special formula that will slowly release the insulin over the next 7 days to help keep your sugars where they should be. The next treatment is to help delay type 1 diabetes. So these are for people who are at high risk of getting type 1 diabetes if you have diabetes, type 1 diabetes in your family. It's for people who are above the age of 8 and are in the early stages of type 1 diabetes who are yet to be showing any symptoms. And it works by helping your body stop your immune system from attacking the pancreas and delaying your need to take insulin shots. And in the studies, some people were able to stop or not take insulin for up to 4 years, which is amazing. And how it's given is a little tedious at first, but for 4 years not getting any insulin shots, I'll take it. It's a daily infusion for 14 days. And lastly, it can be expensive. It's $194,000, but that's without insurance or any discounts.
Oh.
Now we're going to go into what's being studied now in diabetes. There's 4 different things that are coming out. So one is new oral insulin. So rather than injecting yourself every day, you're just going to be taking a pill. And so that's going to be less injections for you and maybe even help with remembering to take your medication every single day. Next, we have the weekly GLP-1 and insulin combos. So what I talked about, how there's a new weekly insulin coming out, they're also trying to combine it with a GLP-1 that is also weekly, like Ozempic, and combining them so you just give yourself one shot and it has the insulin and the GLP-1 in it together. Next is going to be an oral GLP-1 like the Ribelsis that Kai talked about with an SGLT2 inhibitor. And so those two are combined in one little tablet that you just take every single day, and it has both of those medications to help you. And then lastly is smart pens. So it's using artificial intelligence, but it's adjusting automatically your insulin doses based off of how your CGMs, the monitors, how your sugars are reading, and your food logs, and then being able to change your insulin to what dose you do need. And that is all we have for y'all today. Thank you so much for listening. Do y'all have any questions?
People could hear me. Do you have a list of all of the drugs that you had? Any place?
We did make a little handout. We didn't print it, but we can send it to somebody that can email. We can send it to Lucy, and she can give you a list of all of the medications that we spoke about today.
Okay.
And we'll also send the slides out too.
Two things. Number one, did I understand correctly that the over-the-counter monitors are not intended to diagnose hypoglycemia?
Yes, that is true.
Okay, what we have is an abundance of attorneys. Let me jump ahead. It's worth noting that the brain does not store sugar. It survives on circulating glucose. I've had the experience, obviously fatal, of a lady who gave herself probably additional insulin because of dementia and entered with a glucose of 0. The result is obvious. So, in my mind, we have a discordance here. One of the purposes that I would tell my patients, which I don't have anymore because I'm retired, is respond to a low blood sugar monitor warning by getting some glucose in you first, then worrying about the rest of it. This is a danger. I experienced lesser degrees of hypoglycemia with my wife, who was insulin dependent. So I just would like to put that out there because I think that's really worth patient education as we go forward. I've had a chance to see wonderful things happen in the treatment of diabetes. I mentioned them up there, but what we're doing now with the GLPs, the mixed agents and things like that is absolutely unique. It's stunning, and it's going to be terrific to see what the future developments are also.
I just wanted to comment on, can the CGMs diagnose low blood sugar? And it's with the over-the-counter, but also the prescription CGMs, they say do a finger stick to be sure. And my concern as a clinician is, do you have time to do a finger stick? And maybe where are you if you're out in the middle of the Walmart? So what I tell my patients to do is, if you feel it, look at your phone and treat it. You know, if you're at home and you have time to do the finger stick, fine. But, you know, the low blood sugars can come on very quickly. I'll tell you a quick story. I was dispensing medications at a pharmacy when I was in training, and we had a gentleman in line. This was at a VA medical center waiting to pick up his meds, started to feel a little low, didn't, you know, and went down not 20 or 30 feet to a vending machine, said, I'm going to get me candy bar and I'll start feeling better. And by the time the sweets had landed, he was already on the ground. And a pharmacy technician thinking on her feet, came right out there with glucose gel, and they put the gel, and that got him back up and going. So those low experiences can happen on fast and can be dangerous quickly.
Yeah, absolutely. What we have there, though, is one source of information saying it's not intended for that purpose, but that it should be obvious that it is. And oddly enough, remember, you can find glucose tablets in the diabetes section. That's a good thing to have in a purse or available if you're running into that.
Anyone else have a question?
I was on a metformin research study several years ago. Actually, I did two diabetes studies. I was a research volunteer. I was a guinea pig. I was on Actos for about 2 years through the Texas Diabetes Institute, and the weight gain was significant. I'd like to lose weight again, but during that study, I gained about 20 pounds over the 2 years. So I was kind of glad to come off of that study, but glad to help science anyway. On the metformin study, I was on that study through the VA and the UT Health Science Center, and was on metformin for 2 years. And I'm off it now. The study has concluded, and I'm waiting for the data to all be analyzed and everything, so I can tell my provider whether or not I was on placebo or the real thing. So all that to say, if you have a chance to enroll as a research volunteer in a pre-diabetes study, would sure encourage you to do that. There's so much need for research volunteers.
Anyone else have a question? Okay, thank you.
Well, thank you all so much. We're going to send Lucy out the slides and a table of all the medications. Thank you for hosting us. It's now our 3rd time out here, and we really enjoy coming out. And please, you could let Lucy know if you have other presentation topics you might be interested in hearing about.